Hello, my name is Zara and I'll be the team leader for today's presentation. My teammates Melissa, Rabina and Pravnav will be discussing the case study for our patient Mrs. Mary Finich and the connection to the topic of ischemic strokes. Mrs. Mary Finich is a 78-year-old lady that has suffered a ischemic stroke. The CT angiogram showed a left acute internal carotid artery occlusion, and she was admitted to the hospital. Now, to get a bit of background information on the topic of ischemic strokes, I would like to explain a brief definition of what an ischemic stroke is. A stroke occurs when there is a disruption to the blood supply in the brain region. This can result in permanent neurological deficits and death. A stroke can be classified as ischemic or hemorrhagic. Ischemic strokes account for about 85% of all strokes. Cerebral ischemia results from cerebral artery occlusions obstructing blood flow to a portion of the brain. The ischemic stroke can be categorized into four main categories: small vessel disease, atherothrombotic, the cardioembolus, and undetermined causes. Now, question 1. What is the pathogenesis of an ischemic stroke? Specifically, relate your answer to the risk factors associated with Miss Mary Finich. The pathophysiology of an ischemic stroke is when neurons are deprived of oxygen due to a blockage in the artery of the brain, as the surrounding tissue is deprived of oxygen and energy. This causes an effect on the brain function and depending on the location of the blockage. There are two mechanisms that can cause an ischemic stroke, one of them being an endothelial cell dysfunction. This happens when something is causing irritation and inflammation to the tunica intima, which is the inner lining of an artery. Atherosclerosis, which is a plaque causing the blockage caused by the irritation. This is formed by a buildup of fats, cholesterol, proteins, calcium, and immune cells. Another mechanism being an embolism, which is when a blood clot breaks away from another area of the brain and moves to an area where it completely blocks the blood flow, commonly in vessels that are smaller in diameter. These mechanisms cause a reduction on blood flow, and the neurons surrounding the tissue are unable to sustain their normal homeostasis, which can lead to several processes that can cause cell death. Some causes being endotoxicity, oxidative and native stress, inflammation, and apoptosis. These injuries can cause major damage to the neurons, glia, and endothelial cells, which are interlinked, causing triggering with each other and positive feedback loop that causes nerve destruction inside the brain. With Mrs. Mary Finich, CT perfusion assessment was conducted using a mean transit time and time to peak. These images showed that there was a reduced blood flow in the left middle cerebral artery, which is a primary function to supply specific regions of the brain with oxygenated blood. There was a vascular territory that was extending from the middle cerebellum, which is the central area of white matter found underneath the cerebral cortex of the brain, to the deep white matter at the centrum semivole above the lateral ventricle. A CT angiogram showed that the left acute internal carotid artery occlusion, concluding that the patient has suffered an ischemic stroke. Now on to Melissa to speak about ischemic penumbra.
Thank you, Zara. The ischemic penumbra is a region of the brain that can be salvaged from ischemia in the case of an ischemic stroke. This is because the area is supplied by not only the occluded artery, but also by other vessels. Thus, its nutrient supply is not entirely inhibited. The ischemic penumbra surrounds the ischemic core, which is an irreversibly damaged area of the brain where neuronal necrosis has already occurred. While neurons within the ischemic penumbra are not in a functioning state, they are not yet so damaged that they are destined to die. If this area is reperfused in a timely fashion, blood flow can be restored and function of the ischemic penumbra can return. Ideally, this area should be reperfused within 6 hours to facilitate this restoration of function, otherwise neuronal necrosis can occur. This highlights the importance of time in the case of stroke. The phrase "time is brain" is commonly used to establish the importance of timely intervention to salvage as much brain function as possible. In Mary's case, since she has experienced a left middle cerebral artery stroke, she's experienced aphasia, a language disruption that often follows this specific type of stroke. It is evident that the damage done to her brain is already substantial. Therefore, timely reperfusion is paramount to ensure that further damage can be prevented. The left middle cerebral artery supplies Broca's area and Wernicke's area, both integral to language production and understanding. Thus, further damage to this area through the death of neurons within the ischemic penumbra will cause severe and irreversible damage to Mary's ability to communicate. Alongside this, as neuronal damage increases, prognoses worsen, meaning that the faster the ischemic penumbra is reperfused, the better health outcomes may be for Mary. I'll now pass over to Pranav, who will be talking about a few of the drugs used in the case of stroke and the nursing responsibilities affiliated with them.
Thank you, Mel. Alteplase is a thrombolytic medication used to treat acute ischemic stroke. It works primarily by dissolving blood clots and enhancing blood flow to the brain. Additionally, it can be utilized to treat myocardial infarction and pulmonary embolism. The most common side effects include brain and gastrointestinal hemorrhage. Additionally, possible adverse effects include allergic reactions, low blood pressures, and fever. Patients should be closely monitored before and after treatment for any signs of bleeding, and these risks should be carefully evaluated, especially in patients who are at high risk of bleeding. Heparin is an anticoagulant used to cure conditions caused particularly by blood clot formations such as deep vein thrombosis, pulmonary embolism, and cardiac conditions. Majorly, it is used for thromboprophylaxis in patients. Adverse effects include bleeding, which can cause thrombocytopenia. The most important nursing consideration prior to giving heparin is that Mary should be monitored for signs for bleeding, and regular blood tests may be required to assess the adequacy of anticoagulation. Labetalol is a beta blocker and alpha blocker, which is used to treat high blood pressure and hypertensive related problems. It is used to control high blood pressure in people who also have specific comorbid conditions such as preeclampsia. The most typical side effects are nausea, headaches, and tiredness. Both bradycardia and hypotension can be brought on by labetalol. Throughout the course of treatment, Mary's blood pressure and heart rate should be periodically checked. Novorapid is a fast-acting insulin which is used to prevent high blood sugar in patients with both diabetes mellitus type 1 and type 2. Hypoglycemia is the most common adverse effect which can eventually lead to the symptoms like trembling, sweating, and confusion. Mary should be taking care of the reactions she is prone at the injection site, such as redness or swelling. Insulin therapy may also result in weight gain. Mary's blood sugar levels should be periodically checked to monitor and treat hypoglycemia. Now, I will pass the presentation on to Rubina, who will delve into diagnostic procedures commonly used to diagnose ischemic stroke.
Pranav, I want to express my gratitude for your comprehensive explanation of nursing responsibilities associated with medication administration. With that foundation laid, I am now eager to delve into the topic of common diagnostic procedures used for diagnosing ischemic stroke. To enhance responsiveness to a person experiencing a stroke, we utilize the FAST acronym, which stands for facial drooping, arm weakness, speech difficulties, and time, to prompt the immediate calling of emergency services. Diagnosing stroke relies on the two fundamental pillars, history and neurological examination. One of the key historical features frequently observed is the abrupt onset of symptoms. These symptoms encompass focal weaknesses and speech disturbances as highlighted by Considine. It is crucial to perform this assessment promptly as the effectiveness of ischemic therapies may diminish over time. One of the fastest and most available imaging is the non-contrasted computed tomography. It helps rule out the interracial hemorrhage by 95% accuracy and stroke mimickers such as tumors. It also helps assess the sustainability of reperfusion therapy. One of the earliest systemic changes to be seen in the scan is hyperattenuation, greater than a third of the cerebral hemisphere. Magnetic resonance imaging, also known as MRI, also help detect brain ischemics. It is greater spatial resolution which helps identify ischemic lesions with higher accuracy using diffusion weighted image. Findings from these MRI sequences help determine stroke mechanism and therefore inform treatment decisions. For example, Leeson's mismatch profiles enabled assessment of potential risk and benefits of thrombosis by providing information and salvable tissues of ischemic lesion age. Ultrasound imaging also helps with diagnosis. It helps to assess the flow of ventricle through studying blood vessels, characterized and blood flow. It also helps to study anatomical structures and organ functions. It is therefore essential in diagnosing the treatment decision making. Ultrasound imaging is non-invasive, low cost, and safe. It also allows rapid real-time imaging, which is important since time is brain. Finally, vascular imaging such as catheter angiography helps with visualizing blood flow. However, given the risk associated with catheter-based angiography, it is not an initial imaging modality. We have now reached the conclusion of our presentation, and I would like to express my sincere gratitude to Zara, Melissa, and Pranav for their enlightening decision on the case study involving our patient Mrs. Mary French and its relevance to the topic of ischemic stroke. Thank you all for your valuable contributions.